I want to talk about COVID for a moment because, frankly, it's impossible to ignore right now. It really seemed like the pandemic was winding down and then Delta hit. And now we're seeing case numbers in Oregon that we haven't seen since January, which was before most people were vaccinated. And I know there was a lot of concern with a lot of people about breakthrough cases, which is when a fully vaccinated person still catches COVID. Now, I want to bring in Pat Doris to talk about that with us right now. Pat, what do we know about breakthrough cases right now in Oregon?
Well, Dan, we just got the latest numbers for July, and they are growing significantly. In June, by my math, we had about 580 cases, but in July, we had about 2,300. More than that, actually, 2,377. So 19% of all the cases in July happened with people who had already been vaccinated. So that's what those breakthroughs are that you mentioned. And that's kind of scary. That means that you're not bulletproof just because you got the vaccine.
You know, and again, the vaccine was never a cure. It was just supposed to be a layer of protection. But we're starting to see a lot of breakthrough cases, and it's getting to the point where I think everybody knows, at least, through 1 or 2 degrees of separation, someone who is fully vaccinated and has tested positive for COVID. So what is the reason here? Do they think it's because people are together more often, that people feel this sense of security, like the virus does not exist, or that they are completely invulnerable to it? Or is it because maybe the vaccine isn't as effective as we thought? What are we supposed to take away from numbers like that?
Well, I think it's a whole mix in that stew. It's the mask mandates have gone away, so we all think, hey, great, this thing's over. If I'm vaccinated, I am bulletproof. I can literally, they have said, get back to living the life that you lived before all this happened. So we're all like, great, okay. So there's that. And then there's also this Delta variant, which is very transmissible. And so that's a problem too. And one of the reasons we're being told now again to start wearing masks is because those of us who are vaccinated can get the virus in our nasal passages and maybe give it to another vaccinated person who then takes it home and gives it to their kids who are too young to get vaccinated. And so it's really spreading in a tricky kind of way, and I think we have to be careful.
Now, there are very different experiences with COVID. There are the people who have no symptoms, people who have mild symptoms, people who feel as sick as they ever have, but they still are at home and are able to feel better eventually. I'm most concerned about the breakthrough cases where people end up in the hospital. What do we know about the people who are going to the hospital?
Well, it's a very small number of the people who are fully vaccinated. Mostly what you're going to get with the vaccination is an almost guarantee card that you're not going to the hospital. I believe the people that end up there and that are in serious trouble are the elderly who have significant underlying conditions. But for the most part, what the hospitals are seeing are people who are unvaccinated.
All right. Pat Doris, thank you so much.